I'm going to also ask for you to put yourselves on mute and stay on mute during the presentation. And if you have any questions, feel free to put them in the chat, and we will then, I'll kind of collate them and ask our presenters towards the end, and we'll make some announcements at the end, and it's all good. I hope you find that this is a really powerful session, Cannabis and Cancer. I think it's a hot topic and really in demand, and we've got some really top experts here to offer us their knowledge and insights and expertise on something that we want all good information on, right? So I'm Tracy, I'm from OCRA, and Sarah is here. Hi, Sarah. Sarah DeFeo. So it's always good to see you. We want to thank our presenters, truly, Dr. David Gordon and Katherine Golden, for their willingness to come and really present this important material. And I thought maybe it would be helpful if I kind of do a little introduction about our presentation, our presenters, just so you know who they are, and then we'll get started. So Dr. Gordon is a cannabis and integrative medicine specialist, currently in practice in Denver, Colorado area. He received his medical degree from the University of Colorado and is board certified in internal medicine and integrative medicine. He is a diplomat in the Academy of Integrative Health and Medicine, and truly has a wealth of knowledge, and we're excited to have you here. Katherine Golden, you're an RN and the CEO and executive director of Leaf 411, which is a great organization that promotes and provides education and directional support to the public around the safe use of legal cannabis. So this is really great, and we thank you for being here. And I'm going to turn this over to you both. Thank you. Welcome.
Awesome, Tracy. Thank you very much. And thanks to everybody, especially for letting me as a male join your woman-to-woman presentation. So I appreciate you letting me into your space. And I look forward to chatting with you all. I'm going to share my screen here. So hopefully that shares fine. Can you guys see this all okay? I can't see you, so if it's not showing, someone unmute and please holler.
That's great.
Excellent. So I'm going to start just not with my words, but the words of a ovarian cancer patient.
First one is medical marijuana. I had a huge stigma against marijuana ever since I was growing up. Being an athlete, marijuana was just a no-go. But when I was diagnosed, I had a lot of information thrown at me, and my dad and stepmom were the ones who brought the information about medical marijuana to me, and that's when I really dove into it. And my doctor even suggested getting a medical marijuana card. And when I did that, holy crap. Chemo, my energy, everything, I swear, changed. Like, did a 360 within like a week. I noticed instantly on chemotherapy, I was not exhausted for a week. I was only tired for maybe a day, 2 days max. I wasn't nauseous. My appetite was actually coming back, and I started to gain weight, which weight gain was almost nearly impossible for me. I was 97 pounds, 2 pounds away from a feeding tube, and I was able to sleep. Like, sleeping when you're on chemo, especially with ovarian cancer, I'm in menopause, so sleep was non-existent. I would get maybe 1 to 2 hours a night. Now I was getting like 9 hours, and I would wake up and my body would just feel better. So that, I believe, has really been why I have been able to go mountain biking after chemo. Chemo was yesterday, y'all. Like, this is insane. I know that this isn't normal, but I'm doing something that also isn't normal. I'm going out of the box and taking my health into my own hands, and medical marijuana and healthy eating has completely changed the game for me.
Well, I thank her for those words. And, you know, this topic is, needless to say, has a lot of interest, and a lot of reasons it has interest is because of stories like that, people really struggling with all aspects of their cancer diagnosis and their cancer treatment. And and looking for options that are really more effective than the ones they've been given. And I don't show that to suggest everyone has kind of transformative a situation when they introduce cannabis into their regimen, but more to reiterate that this is a challenging condition people go through, and they need options, and they need to know what options are out there. So hopefully that's what Katherine and I are going to do today, is kind of give some background on kind of why we think about using cannabis as a therapy as part of a cancer regimen, and how to do that safe and effectively. Just a little bit more on my background, just in terms of how I got here. I'm an internal medicine doc. I went into private practice right out of training. Pretty quickly realized a lot of how we manage chronic disease and how we prevent chronic disease was really insufficient. So I spent really my career looking for better options than kind of just the template I was given in training. That led me into the integrative and functional medicine space, which really opens the toolbox and focuses on root cause of chronic diseases. Cannabis became part of that when Colorado legalized it for medicinal use in 2010. Kind of continued to use it with patients where it fit into the mix. I closed my main primary care practice in 2018. And the last 3+ years really spent more time in the cannabis space, kind of working with patients, working with companies, doing a lot of educational things like this, just kind of helping people understand this and finding ways, again, to use it safely and effectively. One of the things you'll find with cancer is it's both simple and complex. It's simple because the basics work really well, but it's complex because you'll learn there's a lot of ways we have to think about cannabis a little differently than we think about other therapies. So I don't have anywhere close to enough time to give you all the information I want, because again, there's so much that people need to know about cannabis, but I'll hopefully touch on some of these myths. Cannabis has invokes a lot of strong opinions throughout the world, but especially in the United States. A lot of that's through 80 years of pretty aggressive propaganda, anti-cannabis propaganda, and it's still a federally illegal substance. Although states have obviously taken the lead in giving patients access to this, but there's still a lot of misinformation from all these years of propaganda. So these are some of the myths that people commonly come with, and they kind of come to the table with why they're either scared of cannabis or why they're don't think it's an option. And certainly a lot of these myths are prevalent coming out of healthcare practitioners' mouths as well. So hopefully by the end of our discussion, these myths won't make so much sense, and you'll kind of understand a little more about what cannabis is and again, how it can be used. And that's really the goal of this talk, to come at it from more of a patient perspective. There's much bigger detail, and if there's healthcare practitioners that want more knowledge, there's some resources for that, and happy to answer that in the Q&A too. These are some questions beyond just breaking the myths, but these are some questions that we get from really patients across the board. These are common questions amongst patients dealing with cancer, but it's less about someone's diagnosis. It's more about just simply what their goals are, what they're struggling with, and as we'll find, cannabis fits into a lot of different conditions. But certainly people care about, is it safe? Can it help them with the symptoms they're having? And then how to go about using it. So we'll touch on a lot of these things. And then when you hear from Katherine, you're going to hear some great resources for how to keep answering these questions as you move forward. When it comes to cancer, most of the time we're talking about using cannabis for symptoms associated with cancer. That could be symptoms literally from the cancer itself, or more often symptoms from the treatment. No stranger to those here I'm speaking with that cancer treatment, while life-saving or life-extending and the cornerstone of our care plan, is not innocuous. It's obviously fraught with a variety of side effects as well. So these are things that commonly pop up. Of course, there's more, but far and away, these are the 7 I hear most people talk to me about, and the symptoms that I would say almost any cancer patient in treatment is dealing with at least 2 or 3 of these, if not 5 or 6 of them. So I suspect these are common symptoms that resonate with you and your circle. And what we do currently, we try to address these symptoms in a conventional model, but in a conventional model, for the most part, it's pharmaceutical based. There's obviously other options that are sometimes discussed. Sadly, I don't find options outside of pharmaceuticals discussed enough, but I'm excited that I do see acupuncture in chemotherapy suites and other modalities being discussed. But typically we think of pharmaceuticals, and one option is just to give a different pharmaceutical for every symptom that develops, and that list could keep getting longer. Unfortunately, few of these pharmaceuticals are even FDA approved for the condition in cancer treatment. Many of them don't work well, and certainly many of them are fraught with a whole range of side effects that people are trying to avoid. So cannabis presents an option that could address a whole variety of someone's symptoms. It's a very well tolerated medicine, which we'll talk about. It's very flexible in terms of many different ways to administer it. And when I say safer and more effective than alternatives, I put question marks there because there's very few head-to-head clinical trials comparing, say, cannabis to Ambien for sleep, or cannabis to, Zoloft for depression. So this is more my clinical experience and just knowing how these agents work. I put this slide up not to say we're going to talk about all these conditions, but more it should catch your eye. There's very few medicines that treat, so to speak, everything. So when you see a slide like this, that cannabis is a potential therapy for so many different conditions, you almost should have your, excuse my language, but bullshit meter turn on and say, well, that's the snake oil. That's what I've heard. Cannabis is just snake oil, because there's no way one thing can treat so many diseases. And there's not definitive proof that cannabis treats all these conditions or others that could be on this list. But there is preliminary evidence that cannabis could play a role in all of these conditions, or at least addressing them. So it should start you thinking, how is that possible? And so I put this slide up to have you think, why is cannabis such a diverse agent? Why can it treat so many different things? And the answer to why has to do with what we call the endocannabinoid system. So the endocannabinoid system stands for essentially internal cannabis system. So the endocannabinoid system is our own physiologic system. So just like we have a respiratory system, a nervous system, a circulatory system, we have an endocannabinoid system. So basically we make our own cannabis compounds. And these cannabis compounds provide balance in the body. The medical term for this is homeostasis, but basically the body likes to stay in balance, but it's hit with a variety of inputs over time. And homeostasis is the body's ability to control the internal environment despite a changing external environment. Obviously, this happens physiologically, but it happens in our lives as well. We always try to keep ourselves stable and controlled despite a widely changing external environment. And so that's what the endocannabinoid system does. It brings the body into balance. It does it through some 5 core functions. It helps us relax. It helps get us out of our fight or flight response, helps regulate how much and how often we eat, how much and how often we sleep. It actually helps us forget. It's one of the key systems to help us forget, which initially you might think of as a bad thing, but we have to forget. If we can't forget, we get overrun by fear, by pain, and by anxiety, and our brain just can't handle all the input. So that's a key function. And then it protects us, but not from the outside world. That's the job of the immune system. The endocannabinoid system protects us from ourselves, basically. It protects us from an overactive immune system. And so this system is operating all the time, providing balance in the body, protecting ourselves, and it balances all our other systems. So you can start to see with cannabis compounds acting on this system why we have the potential to treat so many different areas. So I mentioned we've got this endocannabinoid system, and then about 30,000 years ago, a plant evolved that literally makes chemicals that bind to the exact same set of receptors in the body that these internal cannabis compounds do. So the compounds in the plant have the ability to mimic our own system, augment our own system, and really provide that same balance and self-regulation that our own system does. Our bodies are under assault from a whole variety of things these days. We see the rise in chronic disease, and really that's due to just the body being out of balance, whether it's toxin inputs, whether it's chronic stressors, the list goes on as the causes for chronic disease. And so often our own cannabis system is kind of overrun, can't keep that balance in play. The plant comes along and the chemicals in the plant can help restore that balance. So that's really a big picture of how cannabis works and why cannabis works. It's not this magical elixir. It's working through our own physiologic system, bringing the body back in balance and working on some specific symptoms along the way. I want to touch on some terminology as we kind of start talking about the plant and how to use it a little bit more. You're going to hear three words primarily: cannabis, hemp, and marijuana. And different folks will use those in different contexts, and many will use them, so to speak, inaccurately. So just to be clear, we're talking about a plant. The plant's name is cannabis. So everything we talk about is cannabis. Hemp is cannabis, marijuana is cannabis. Cannabis is the most inclusive term. And just like other species, I'm using dogs here in this example, cannabis can have many different types within its species, and these types look differently, act differently, have different behaviors. And so just as you see with dogs are all the same species, but again, clear differences just in the three photos I've shown, but throughout the entire species. The cannabis plant is no different. So different cannabis plants look differently, grow differently, behave differently, make different amounts of chemicals. And what the government has decided is, if you take one chemical, a chemical called THC, which we'll talk about in a little bit, if it's below a certain percentage of THC in the plant, it's regulated and called hemp. If it's above a certain percentage of THC in the plant, it's regulated and called marijuana. But again, it's all the same plant. And so someone saying, oh, I don't use cannabis, I only use hemp, that's a good sign they don't know what they're talking about. And again, these are more legal and almost political definitions. Cannabis is the scientific name. So that's the word you'll hear me use. A lot of states still use the term marijuana in their legislation. There's a lot of baggage that comes with that term in cannabis history, and a lot of kind of racial baggage, but I won't go into detail. But I'm a fan of just using the plant name, which is cannabis, and then talking about the specifics of it. One of the things you'll also find is you can't lump all cannabis products together. So you can't just say cannabis is good for this or cannabis is bad for this. I really want you to learn a little bit more what's in the plant and how to think about it in that way. So kind of on that topic, what's in cannabis? Cannabis is just a plant, but what we really care about is the medicinal compounds in it. So there's cannabinoids. These are some of the names you've probably heard: THC and CBD, which are the primary cannabinoids we'll talk about more. But there's a host of other cannabinoids as well that have their own set of beneficial properties, and we're learning more about those. Interesting, which we'll touch on. THC is really the only intoxicating compound in the plant. I'm oversimplifying a little bit, but the other cannabinoids we use don't cause any intoxication or, so to speak, getting high effects. There's other valuable compounds in the plant. Terpenes are also called essential oils. So anybody using or knows someone who's using essential oils, these come in all plants, and cannabis is no different. So they provide a lot of the flavor and the smell, but they also have their own physiologic properties. And then there's a host of other compounds: antioxidants, flavonoids. These are things that, again, have physiologic effects. So it's far more than just the THC or the CBD that we have of value when we use cannabis. And this concept we historically call it synergy, where you add two compounds and the benefit of using those compounds is greater than just adding them together. Cannabis, the term is commonly used, Entourage Effect, to describe this concept that when you use all the compounds in the cannabis plant together, you tend to see synergy and have greater benefits than any one compound by itself. A lot of the data in the literature supports this. It's never, quote, been definitively proven, so it's a topic, so to speak, of debate among scientists. But I would say, without a doubt, clinically, I see better results when we're using combinations of different cannabis compounds, and it's also a way for me to judge the value of certain products. We're going to talk about CBD and THC the most because those are the compounds we know the most about and have the most research on. But I think always want to be thinking about using cannabis products that have these other compounds. If you're using the plant, the actual plant material, it's pretty easy because it's got everything. But when you're using edible products or anything that had to extract these compounds from the plant, you want to ask what else is in there besides THC and CBD. I mentioned I want to talk about CBD and THC the most, though, because again, that's how products are labeled and those are the compounds we know the most about. I'll start with CBD. CBD is, even though maybe only have heard about it the last few years, it's of course been in cannabis for all of cannabis's existence. CBD doesn't get you high, so when cannabis kind of went underground in the 80s, and all the breeding exploded with all these different strains, CBD was kind of bred out because the goal was to really just breed cannabis strains that had high THC and got people high. So CBD kind of was missing for a while. Thankfully, it's coming back. It has a variety of valuable benefits. It really makes our own system work better. So CBD augments just our own cannabis system. CBD allows us to use a little more THC. For most people, THC will buffer, or CBD will buffer some of the negatives or potential side effects that THC might cause. So having CBD on board allows you to use a bit more THC. It's extremely safe. There's actually a prescription version of CBD available now for pediatric seizure disorders. A lot of those kids take 500, 1,000, 1,500 milligrams of CBD a day. We often use significantly less for that in clinical practice for patients. So again, very, very safe. It's not completely side effect free, but I would say it's certainly probably the most well-tolerated medicine that I've come around, and really works in a variety of areas, both for symptoms and kind of balancing our system. I want to talk about safety a few times during this talk. This is one area when talking about CBD, I want to bring up drug interactions, because of all the chemicals in the cannabis plant, drug interactions are potential, but CBD probably has the most drug interactions. That being said, rarely do they cause a problem. Rarely do they prevent someone from using CBD. Standard chemo protocols, certainly those for ovarian cancer, there's no concerns with CBD. And in fact, CBD, at least in preliminary research, seems to augment chemotherapy. There's a few special situations, though. There's modern immunotherapies that are being used more and more. I don't see them as much immediately in ovarian cancer regimens, but they are growing in use. And there's some additional questions there. Won't go into detail here, but if you're on kind of a modern immunotherapy, definitely a specific discussion with a cannabis professional and your oncology team to decide if cannabis could negatively interact with those immunotherapies. Other special care, especially for those taking seizure medicines, blood thinners, some antifungal medicines. Again, CBD can be used safely as well as other cannabis compounds, but you need to pay attention. These drug interactions are easy to check through even just an online system or an electronic medical record. Sometimes cannabis will lower blood sugars and blood pressure. We don't think of it as primary treatment for that, but if someone's already taking medication for those things, you need to pay attention. You might be able to taper down some of those prescriptions if cannabis is having some additive effects. When it comes to THC, THC is probably the more potent medicine in the plant. People think of THC as the drug and CBD as the medicine. That couldn't be farther from the truth. THC is the medicine that's probably used most commonly, has the most research behind it. It's probably been used historically for the longest amount of time, which is over 5,000 years. THC directly stimulates and directly mimics the action of our own cannabinoids. So it mimics that balancing, it augments that balancing of the body, that relax, eat, sleep, forget, and protect. And I think THC really should be in any regimen, but just because you're including THC does not mean you're getting high. THC is the chemical that can cause you to be high if the dose is strong enough, but THC is valuable even at non-intoxicating dosages. We'll talk in numbers a little bit towards the end, but just no one should be afraid of THC. We have to be more careful with it because it has more potential for side effects, but low dose often works very well. Non-intoxicating dosages work well, and higher dosages aren't necessarily better. So again, we use the kind of start low and go slowly with THC, but the typical cannabis regimen that's going to be most effective is at least going to have some THC in it. And at least compared to CBD, THC is probably more effective for nausea, neuropathy, appetite stimulation, and depression as well. So obviously these are common symptoms cancer patients deal with, and so THC likely a valuable part of that routine. I mentioned THC, though, a little bit shorter, what we call therapeutic window or therapeutic index, meaning that at the doses that are effective, you can start having some side effects. These are some of what we call the acute side effects of THC, meaning the things that happen, while you're using it. Dry mouth is the most common, far and away. It's usually pretty tolerable, but where I am in Colorado, people are dry already, so sometimes it's not well tolerated. And then kind of what we call is getting high. It involves kind of a disruption of intention, short-term memory, sometimes coordination, different, just at high dose, even a different sense of reality, which for some people can cause panic or even paranoia at very high dose. THC can be a sedative, where it can also affect motivation, things like that. And then euphoria is also listed as a side effect. So a few things about all these side effects, and I'll touch on euphoria more in a moment. First, they're all dose dependent. Just because this is a list of side effects does not mean everybody gets these. In fact, when you start THC at a low dose and go up slowly, you could typically avoid all of these. The other thing to note, a lot of these quote side effects are things where actually going to use as a valuable treatment. So the definition of euphoria, for example, is increased pleasure and happiness. That's listed as a side effect of THC. So when you're struggling with cancer, you're struggling with chemo, pain, all the emotional baggage that comes with a cancer diagnosis, feeling just a little increased pleasure and happiness for an evening, I don't really think of as a side effect. Likewise, if your sense of reality is even, you're at a dose where there's a little altered sense of reality where time's not as important, things like that, those are pretty valuable things for people to just sit and enjoy a movie and be hyper focused on that movie and not be thinking about their life or their cancer or their chemo the next day. So some of the things that are side effects of THC actually can be valuable aspects of its therapeutic role. So again, with THC, we just start low, go slowly, and find that dose that's going to be effective and kind of cause that right balance of symptom relief and that kind of euphoric component without causing side effects. On the safety side as well, though, THC is there's no large scale toxicity. So even if you took way too much THC, you're not going to damage your heart, you're not going to damage your liver, you're not going to damage your kidney, you're not going to damage your brain, you're not going to stop breathing, you're not going to die. You may feel uncomfortable, you may feel anxious, you may feel paranoid, you may have an uncomfortable several hours, but you're not going to do any damage to your body. And that is something obviously very different than most of the other medicines we use, which in taking too much or an overdose could be lethal. When you're out in the stores or when you're talking to patients, it's really important to talk about this balance of CBD and THC. That's how a lot of products are labeled. And again, we want to use both compounds, and depending on what time of day and what we're trying to achieve, we adjust that level of potential intoxication. And when I say intoxication, I mean that kind of that hyper pleasure and happiness, that slightly altered sense of time or reality, that decreased coordination, those things, if someone's comfortable with that, they might use a higher THC product. Balanced CBD and THC products, which we use a lot, commonly called a 1-to-1 ratio, that level of intoxication could be pretty mild. And then high CBD products rarely, if ever, cause any intoxication, no matter how much you use. So the dose is important, but so is the ratio. And those are two terms that can answer questions on, and just want to introduce here, because as you're looking at products and looking at options, you're going to care about the ratio of CBD to THC and then the individual dose. So 5 milligrams of each is a 1-to-1 ratio. 20 milligrams of each is also a 1-to-1 ratio, but 4 times the dose, for example. So dose and ratio are really key terms when helping to understand the products that are out there. And there's a lot of products out there, especially in the state where I am, Colorado. You guys are obviously all around the country, so every state's going to be a little different for you in terms of what the legalization has looked like, whether it's recreational or medical, or what types of products are available. But this is just a sampling of how you could put cannabis in the body. In the bottom right, you see pictures of the cannabis flowers. Those are basically the flowering tops of female plants, and you could kind of see them probably. There's these little, what look like crystals. Basically, these are sacs of oil that have the medicinal compounds in there that are all over these flowers. But then you can extract the compounds and put them in foods, put them in drops, put them in tinctures, put them in powders. The list goes on, and we'll touch on a few of these. A few take-home points is there's no one best method. There's just pros and cons of each of these different administration methods. So there's not, this is the way you should use it. And the other thing, the combination of all these different options and the fact that there's a whole lot of different cannabis compounds and ratios means that, again, there's not one cannabis product. It's not cannabis is good for pain. Someone has to say, well, oh, cannabis is good for pain. Well, what do you mean by cannabis? Do you mean CBD only? Do you mean THC only? Do you use a combination of those? Do you use other compounds in the plant? Are you smoking it? Are you eating it? So you can see there's a lot of questions involved. So anybody trying to simplify cannabis down to good or bad is just not doing their work. And so I hope you'll continue to kind of get the information you need to make decisions. And when you do the education and have guidance, it makes it so much more effective. You get a starting point, and then you keep making adjustments till you find the regimen that really works best for you as an individual. Touch on a few types of administration. Topicals, these are creams, salves, ointments, things like that. Typically, you're putting these on spots where it hurts. If you can push on it and it hurts, it's reasonable to use a cannabis topical. There's virtually no absorption into the bloodstream if used appropriately. So you're not, even if with all THC, there's no chance of getting high. You're really just putting spot treatment on a tender area that hurts. It's a really easy entry point. A lot of people with like hand arthritis use this a lot. It might be the only cannabis product they use. There's not a lot of research on topicals, but we do find people that find them immensely effective. But again, it's got to be a pain area that's kind of close to the surface. So if, for example, if you had a bone metastases from cancer, even if it's in the leg, putting a topical on your thigh is not likely to help a deep bone metastases, for example. But things, muscle spasms, tendinitis, joints that are right on the surface, topical is a great option. And again, some of that propaganda, people might badmouth someone for using cannabis, and all they might be using is putting a cream on, which obviously a whole different safety profile than a 14-year-old kid using high THC concentrates multiple times a day. But both of those are cannabis users. Inhalation. There are some really good reasons to use inhalation, especially for cancer patients, because inhalation works near instantly, seconds to minutes. It also has a very short time of any potential impairment. So if you're using THC in a dose that might cause some impairment or intoxication, that's gone pretty quickly with inhalation. So for a lot of intestinal stuff, nausea, appetite, especially, often inhalation is the best method, because it's like, I feel miserable. I take some amount of inhalation, 1 inhale, 2 inhales, 5 inhales, whatever that appropriate dose is for you. And within seconds to minutes, my nausea is gone and I'm eating. And it often is that simple. It's also the most cost effective, just going into the store, buying some cannabis flower or buying a joint is going to be the cheapest way to go about it. Now, again, smoking is associated with some risk. And when I mean smoking, I mean combustion, so burning the plant. So it's really not the preferred long-term option because of some of the increased toxicity that comes with smoking, and some of the long-term risks of cannabis have nothing to do with cannabis. They more have to do with smoking. But it might be an option for people immediately needing some relief. There's also something called vaporizing, which I'm a big fan of. And vaporizing, most people associate it with negatives because vaporizers got a lot of bad press a couple years ago, which was called the vape crisis, so to speak, where literally people were dying because people were putting additives into black market vaporizer devices. But vaporizing just means evaporation of something into a gas that you can then inhale. So there's a big difference between vaporizing oils with a bunch of additives and other ingredients versus vaporizing the actual flower. We can answer some questions on that. It won't go into too much more detail, but just know that, again, vaporizing flower is an extremely clean and safe way. So the actual buds in that picture up at the top, that's just the flower ground up. Vaporizing that has a very, very, very low side effect profile and is completely unrelated to the vaporizing with other oils and other additives that you often hear being bad now. So again, it just goes to education. All vaporizing isn't good or bad. There's safe and then there's unsafe ways to do it. Inhalation is also a way to incorporate what we call microdosing. Microdosing is the start low, go slow. You start with a little bit, maybe 1 puff, you see how you are in 5 minutes or 10 minutes. If you need more, you take another puff. Wait 10 minutes. If you need more, you take another puff. So it's a way to just kind of incrementally increase this dose to find out what works best. Ingestibles, anything you kind of put in your mouth. This might be things you just traditionally eat, foods, candies, brownies, cookies, gummies, things like that. It might be capsules, pills. It might be things you put under your tongue first, like sprays or drops of oil, but then you eventually swallow. Lots of options out there. For medicinal use, I tell people to look for what I call a medically focused design. So what does that mean? It means it can come in a very low dose. We want to be able to start low, especially with THC containing products. So whether that's 1 drop at a time or a tablet that starts with a low enough dose of THC, I don't want I wanted them to be able to start with 1 or 2 or 3 milligrams of THC, for example. So if they're taking a capsule that the lowest dose is 10 milligrams, not really a ideal product, at least to start with. And again, I'm giving you medicine, so I'm not a big fan of food coloring and sugar, and those are things that you want to avoid when you have cancer. So telling someone to eat cookies and brownies and gummy bears all day, not really what I'm looking for. So I really like to keep those compounds out of my medicine. And the other thing you're seeing companies doing now is using cannabis with other valuable botanicals. And so I have a lot of experience with other botanical and nutraceutical compounds. So I really kind of get excited when I see the power of cannabis combined with those. Ingestibles, it's much more variability. Some products are designed to be rapidly absorbed and work near immediately, but the typical edible, you say 1 or 2 hours for it to work, and it's going to last longer than inhalation. So the key with, if you're using edibles, you can still microdose and you can still start with a little bit, wait and reassess and then take more. But that reassessment time, instead of 10 or 15 minutes for smoking or for inhaling, it's going to be about 2 hours before you make an assessment and redose. Transdermal means you put it on the skin and it gets absorbed into the body. Patches are a common way. There's some creams as well designed for this. These are very convenient because they last a long time. They don't have to get metabolized in the intestinal tract. Cost is, I would say, the biggest challenge with using patches and availability. But if cost comes down or it's not an issue, it can be a valuable way. A lot of people throw a patch on in the morning. It's there for 10, 12 hours working effectively, and then they throw a different patch on for sleep, and it could be a great way to go. So just know that that exists as well. So when we talk about safety, so is cannabis safe? Absolutely, in my opinion. It's certainly when used appropriately. Oddly enough, we have a lot of experience with cannabis being used inappropriately as a social use or recreational drug, as however you want to call it. So even used inappropriately, it's still very safe compared to other things. As I said, you can't really damage your internal organs or anything. That doesn't mean there's no side effects. It's not risk-free. So you can certainly have some side effects from cannabis. We talked about some of the acute effects of just too much THC, which just make you feel uncomfortable. Some of the long-term risks, a lot of that is, again, propaganda, but it doesn't mean it doesn't exist. And some of the bigger questions are in adolescents and pregnant or lactating females, a little beyond the scope to go into full detail there. But again, all treatments we use have potential side effects. Really, if you educate yourself, use this medicine appropriately, really all the side effects are either completely avoidable or if not, very well tolerated. And again, from my clinical experience, I can't say this is necessarily head-to-head trials, but the side effect safety profile is just far superior to most prescription medications. And when you look at patient studies, meaning studies that what is the patient experience using cannabis, universally, they almost always say cannabis products were better tolerated than their other therapies. A lot of the risks actually are associated, again, with the method of administration. So using low quality vaping of oils with a lot of additives and other chemicals put in there, much higher risk. Vaporizing flower, very low risk. Using a high quality edible with a very clean extraction method that doesn't have food coloring and sugar or additives, preservatives, very low risk. Using something that's basically junk food with cannabis squirted in there, less ideal. So product quality is imperative. Katherine will touch on that a little bit more, how you can learn about different companies and know what questions to ask. Can it help? Obviously, that's probably what most people care about. Cancer patients are struggling with a lot, as we talked about. They want something that'll help, and a lot of what we're doing and using to treat patients with cancer isn't working well. Here it gets a little complicated because there's plenty of research showing cannabis is valuable, clinical trials, patient surveys, physician experience. But again, you can't lump cannabis as one medicine. So one trial might show no benefit, but then you look at the details and go, oh, they didn't use enough CBD, or they didn't use enough THC, or they used a poor method of administration for how it's valuable. So you really have to look at the details, and you can't just say, oh, pick one trial. You really have to look at all the data. You have to really use true evidence-based medicine, which doesn't just pick one study and say, I'm going to base all my decisions and extrapolate based on one study. You look at everything out there, all the clinical trials, all the patient data, all the physician clinical experiences. And that data is pretty overwhelming in support. Nausea and pain are probably the best research. Neuropathy, and especially important for your ovarian cancer, of course, chemotherapy-induced peripheral neuropathy is a huge problem. There's no FDA-approved therapies. Most of the treatments used don't work very well and cause a host of side effects. There's a lot of people reporting benefit from cannabis. There are certainly clinical trials showing benefit of cannabis. There's also some animal data that was actually done in Colorado, down in south of Denver, that shows actually using cannabis preventatively may prevent neuropathy from coming on board, especially using CBD and THC in combination. That's animal data, so I can't completely extrapolate, but I think a whole lot of value in nausea and pain. Fatigue, cannabis, especially THC, can make you tired, but if you improve someone's sleep and nausea and appetite and mood and pain, typically you're going to help kind of quote fatigue. So again, a lot of that's finding the right products and the right dosing. Anxiety is another common thing we see a lot of value for. The dosing and products are crucial here. THC with anxiety is what we call biphasic. So a low dose of THC is an anti-anxiety compound, but as we said, with too much THC, it can cause anxiety. Just a quick summary of kind of what we call the Israeli cancer experience. In Israel, they have a very well-organized medical cannabis program where they track everybody. They know exactly what products they're using, very different from our system here. So this was basically over 3,000 patients who entered their medical cannabis program with cancer. About half had metastatic disease. And again, a lot of data, but the ones I look at, basically they did a survey before starting cannabis, and only 20% said they had good or very good quality of life. 6 months after using cannabis, almost 70% of people reported good or very good quality of life. Before they started cannabis, over half were reporting daily pain of 8 out of 10. By the end of 6 months, only 4% were reporting pain on an 8 out of 10 scale or greater, and over a third had stopped whatever opioids they're using. So this is real world, real life patients. This is 3,000 patients who had cancer, who were struggling in Israel, were given the opportunity to use cannabis, and they did great from a symptom management standpoint. So is it definitive proof in a large scale randomized trial? And these people used all different types of cannabis. So we can't extrapolate. All we can say is we take these 3,600 patients in Israel, their life was improved by incorporating cannabis. And based on what we know about it, it's not surprising. When it comes to cannabis treating cancer, the bottom line is we don't have definitive data. We know in the lab, cannabis kills cancer cells, both THC and CBD. It does a whole variety of anti-proliferative and anti-cancer activities. There's very little human data. So the bottom line is it's not a proven therapy to treat cancer. It's absolutely not a replacement for standard of care, but we're very aware that it seems to be also at least an adjunct to someone's anti-cancer regimen. There's certainly plenty of stories of people who had failed all conventional therapies and had some remarkable stories with cannabis. That, of course, is not definitive proof of its effectiveness. Again, we never want to replace your therapy, but with the rare exception of potentially, again, these new immune drugs, if anything, it looks like it's going to be an adjunct to actually treating the cancer. Happy to answer questions on that as well, but going to kind of not go into too much more detail there since it's more of a side benefit, I would say, for most folks. Some details on just kind of what and how much. It's really a personalized issue for how to use cannabis. You have to start low, get some guidance, start somewhere, and then keep track and make adjustments. So it's a much more empowering treatment. You're really in control. These are some common CBD dosages, some common THC dosages. Of course, there's a big range. We usually start at the bottom of that range and then go up every 2 or 3 days. For chronic symptoms, it's usually best dosed 2, 3, 4 times a day. And you don't have to use the same product in the morning that you do in the evening. So a lot of people use non-intoxicating, non-sedating options during the day, and things that are a little more intoxicating and a little more sedating in the evening, but everybody's routine is different. Depending on, some people might use a little inhalation, especially around chemo, to deal with nausea. Other people just find if they're using a maintenance, they don't need inhalation. So these are just some very general tips. And again, a lot of it's going through your own journey and educating yourself in that process. And Katherine will talk about resources to help with that. Some final general tips. When it comes to nausea and appetite, inhalation is often best because it works so quickly. You usually want at least some amount of THC involved there. You start with just a brief inhalation, wait 5 or 10 minutes. That might be all you need. Maybe you redose as you needed. Anxiety, again, it's going to be more of a high CBD, low THC product that's more effective. Too much THC will worsen anxiety. I mentioned neuropathy and some of the data coming out. I really start folks with balanced CBD, THC options, and potentially before the symptoms even develop. Like I said, that's animal data at this point, but it was pretty well done study. So I think reasonable to incorporate that in some maintenance fashion, even before neuropathy is even developing. And just a kind of a final note, I find cannabis to obviously be a very valuable therapy. I work with patients a lot and just teach people how to use it. But my career as a whole has been based around looking at all options available for folks and not just accepting kind of status quo, which is often not very good, as our only option. And so really want people to know there's a wealth of tools out there. Nutrition, you heard Cheyenne allude to at the very end of that video I played at the beginning, that beyond cannabis, nutrition was the other thing that was transformative for her. Cancer feeds off sugar. That's what a PET scan is. It's giving you sugar and seeing where it all goes. It goes right to the cancer. So dietary measures, other lifestyle measures, connection. There's just so many tools in the toolbox to help any patient, but especially someone dealing with cancer. So please make sure you're finding those resources, whether it comes from your oncology team or you having to go out and search for those options yourself. Please know there's a lot of tools out there for you. I'm going to let Katherine talk because for those who need more help, because often I just gave you a lot of information, which hopefully is helpful, but can also be confusing. There's a lot of resources out there. Leaf 411 is, which I'm going to let Katherine describe, is really what we like to call is a great first step, because not only is it a great resource for information, but it's a directional resource. So I'm going to let her kind of go from here, but just know there are a wealth of options out there as you go forward, and it's not like a prescription. Just take this and you'll be fine. It's here. Introduce this into your world, learn how to use it, learn what works best, and you'll likely find amazing results, but you got to do the work. So you want to have resources and education along the way. So I'm going to let Katherine go from there. Then again, we'll answer questions towards the end.
Hi. So Dave, I don't know if you have my slides, but my internet just went down. And
I will look, but start talking. I will see what I can.
All right. And we can do this even without him. I am so sorry. My internet just went down about 10 minutes ago. My daughter's taking a school testing today. So she was just like, what happened? But I connected on my phone. I just don't have my slides on my phone. So I'm going to read them to you. And I'm going to start off by first, telling you where I come from, my journey. I've been a registered nurse for 25 years and in cannabis medicine for 5 now. Dr. Dave and I actually started, and we met together in a cannabis clinician's office. If you talk to most people in the cannabis industry, they're going to have a personal story that led them to cannabis. And mine started way back 2016. And my brother-in-law was suddenly diagnosed with stage 4 lung cancer, given 2 to 5 years to live. And in his all of his doctor's appointments and seeing any kind of going into studies and things like that, there was mention of cannabis, but actually those mentions were just that. It was, sorry, we don't know enough about cannabis, but we'll look at it as a last ditch effort. So me being the only one with a professional license in the family, I said, well, let me look at this cannabis, because quite honestly, I was against it. I believed all the propaganda, as Dave mentioned. I believed it all. I thought, why wouldn't me being a nurse all these years, our medical communities, screaming, our government screaming from the rooftop, like, hey, there's a plant that has potential benefits for all your patients. I looked into cannabis, and I was really quite angered at what I found out, because there is a lot of science. So when people say there's not enough science, that's not true. There's a ton of science. There's a lot of animal and lab science, and now there's gaining momentum on studies with large scale humans and different demographics and everything. So there's a lot of science out there. So I was able to help my brother-in-law with questions, because I started learning cannabis and they were scared. They didn't know where to buy cannabis, what even some of these terms meant, and they were scared to death. They're in California, they have delivery, they were some of the names were frightening to them, they didn't know what they were buying. So here I was able to step in and guide them. So on my journey, I was thinking, well, what about everyone else who doesn't have that person in their family, doesn't have somebody who's doing a deep dive into cannabis and can explain all of this to them? What about them? And that's where my journey began with this nonprofit, Leaf 411. I wanted to have a large scale outreach. We started with a phone, and I know a lot of people told me, oh, that's so antiquated. You should do apps, you should do everything else. But I was like, nope, I want a phone. I want it to be extremely accessible and affordable. So that's why we went to a nonprofit for affordability and accessible on a phone. You can call us from anywhere, on a landline, on a cell phone, over the internet. So there we have it. Leaf 411 is a 501c3 nonprofit. We operate the nation's first only cannabis nurse hotline. There's other support lines out there. There are wonderful ones as well, but usually they're connected with a particular either brand or company, or they're not medical professionals. They know a ton about cannabis. They're wonderful. But when you need that next step and you want somebody to understand what you're talking about when you're saying, hey, like what I know, okay, have you had your CT scan? Things like that, things that you should tell your oncologist and mention. That's where the nurses can take it another level. So Leaf 411, our vision is to make affordable cannabis education for everyone out there. We started with our first program, and that was the hotline, but we have an outreach program and an affordability program. And with the hotline, one of the things that's really important to know is the questions. What can you ask? So now you have all this wonderful information from Dr. Dave. You know everything. He told you about routes. He told you about ratios. He told you about how to make an informed decision or what you need to make an informed decision. Now you think, okay, well, I've learned all that, but I still have questions about my personal journey. That's when you can come to us. We address your fears, build trust, and answer questions. We talk about the difference between CBD and what Dave had mentioned is marijuana, that a lot of states actually use. Here in Colorado, it's called the Marijuana Enforcement Division. You can go to a lot of states and the regulating bodies are using the term marijuana. We like to use cannabis, but for the sake that, for everyone across the country, we call CBD hemp, anything that you can buy over the counter, that's that less than 0.3% THC. Anything with more is sold in a dispensary, and we consider that marijuana. So we try to help our public understand where the government is coming with using those terms. We talk about anything from serving sizes to directional resources, education. We provide plant and cannabinoid education. So now Dr. Dave has told you about what the potential benefits of CBD can do. And you're thinking, wow, okay, I remember him saying something, but does that pertain to me? And that's when you can call us and talk to one of our nurses and ask your questions. We talk about serving sizes. Serving sizes is very important because, the serving size for Colorado, for example, is 10 milligrams of THC. Well, 10 milligrams for most people, including me, would knock me off my rocker. I'd be like, woof, never touch that again. So we like to get in there and explain that serving size is typically too much for someone who has never used cannabis before and is just experimenting, just tiptoeing into this realm of introducing plant medicine. So we talk to you about reducing that. Instead of that 10 milligram serving size, let's go something in the 1 to 2 milligrams of THC. Let's test your body out, but also give you the expectations. Like, we like to set you up for success. So we educate you on, don't expect, let's not put our expectations at this 1 or 2 milligrams. It's going to be the magic elixir, like Dave's saying. There's no magic elixir, but we got to work to find where that sweet spot in each individual body is. So we talk to you about serving sizes. Like I said, product labeling, so confusing sometimes. There's so many numbers on the packaging, and sometimes there's problems. I just took a call this weekend, and someone called very scared to use their product because they opened it up. It was a tincture bottle, and they looked at the pipette or their dropper, and there was no demarcations on it. And they go to a very famous cannabis clinician that said, oh, you've got to make sure you take a quarter dropper of this, and how many times a day they were supposed to take it. And she was scared, and she's like, I'm in so much pain, but I don't even know what a quarter dropper is. Well, that's where we come in. And I said, oh, not to worry. I can do the math for you. Let's do that math, and walked her step by step on how to figure out what a quarter dropper was without even seeing the lines on the dropper. So these are the things that come to us, and we can answer those questions. Our operating hours are Monday through Friday from 8 a.m. to 7 p.m. Mountain Time, but I get those messages all night, all day on my email. So when somebody is saying, help, I need something, this is really important, boy, you bet I'll get on that phone and I'll make sure I jump in. I've had somebody call and say, I just left a dispensary and I'm home now, and I completely forgot if he said to eat the entire chocolate bar or just a piece of it. And I jumped on the phone right away and said, hold on, I can help you. So that's what we like to do, is really be there for you, and answer those questions and address those fears that you're having, so we set you on your way to success. And we're a safe zone. This is a anonymous line. We see as a phone number that comes through, but as you know, even my husband has an LA number from when we were in California 20 years ago, still has it here in Colorado. So we don't assume that the number that you're calling from is where you're at. But in addition, we take non-identifying data too, so we can help you with that. So if you want to give us some of those data questions, and you want to tell us where you're at, we can help you understand the landscape of where you're at and the availability. If you're a medical only state, if you're adult use, maybe you're on the horizon of being adult use, or like New York this year. So we help you understand some of that. Understand the legalities too. I've had lots of people call and say, gosh, I'm a Colorado resident, I have my meds, but I'm going to Florida for vacation. Can I take my THC? Questions like that, we know where to direct you to. If we can't answer it, we're going to find someone to direct you to it that could answer that question. So those are some of the things we can address. As far as what you can find on our website, so we have a lot of information. Some of the things that Dr. Dave was talking to you about was the products, routes, brands, things like that, reputable products. If you go to our website and hover over resources, there is a drop-down box that we have that are vetted resources. We have support members. Like I said, we are a nonprofit, so every bit of our funding is philanthropy. It's people supporting us, and thankfully, our industry stepped up and said, "We're going to support you. We're going to make sure everyone has this free hotline available to them to help guide them to safe and effective use." So you can go on our website and you can see all the resources. We even have Dr. Dave under there, under cannabis clinicians. Their logos, thank you, Dave. Their logos go right to their website. So you can, under the resources, you can see the vetted ones exactly on this page. So now we're at least helping you, because I couldn't have a platform that I said, okay, this is what Dr. Dave is trying to tell you to do, or your doctor. Now, good luck finding a reputable brand. You can click on any of these brands and you can say, oh, okay, here's something in this state or this state that I'm going to. We have hemp, CBD hemp. We have clinicians, like I said. We have marijuana, which are dispensaries and products that are made with higher THC levels. So there's that next, hopefully, hand-holding that we want to provide for you, that we've done our due diligence, knowing that these companies are compliant. There's no red flags against them that we know of. We vetted them. We've visited their locations. If they're in Colorado, met with their executive team, every single one of them, to make sure that they were in line with our values. Our Leaf 411 blogs, we produce weekly blogs. We have a fantastic content writer. I medically review all of them. And these blogs can really help you start learning more about your journey. So please visit our blog page. You can visit our event page. We do virtual events. And then also on our homepage, we have a button that's called the Leaf Library. You click on that leaf library, and boy, you can type in ovarian, just ovarian, or you can just type in cancer, and you can pull up articles that have science to them. You can pull up anything that you want to review, ratios, extraction methods. You can see right there, we have lots of articles. We add to it all the time. We try to kick out some of the old links and refresh them. And we'll be expanding to a more and more robust library. And then lastly is calling us and asking us questions. Leaf411.org is our website. You can go there. We have a chat feature on the bottom of our homepage. So our nurses staff this, taking the calls and also answering your chats. Thank you, Dave. You're awesome. And answering your chats. So you can type in anything. If we are not on the line, please leave us your information, and we always get back to you within 24 to 48 hours on our business days to answer your questions. We love talking to you on phone though. Chat is wonderful, but if you can call us on the phone, we can do kind of what Dave was saying. You have lots of questions. So what do nurses do? We triage, we ask you, we dig a little deeper to make sure that, you are going in the right direction. Because usually you have quite a few symptoms. You have pain, you have nausea, maybe some anxiety that comes along with your condition. Well, we're going to focus on one, and we're going to say, okay, let's tackle your number one, and let's start from there. If you get some great consultation from Dr. Dave or any other cannabis clinician you're working with, or any clinician at all, those are questions you can run by the nurse and say, gosh, I had actually someone call me and say, my doctor said to take a 20-to-1, and I have no idea what that means. So can you help me? It's like, great, those are easy for us. We can help you understand what a 20-to-1, what a 1-to-1 is, and review that. They reviewed it in their office. They reviewed that over the phone or telehealth. But we know you have a lot on your shoulders. You have a lot you're dealing with. So we will be there for you to help explain step by step. We have people that call us all the time that say, okay, the next step is this. Can you help me through that? Absolutely. You want to give resources to your clinician. Say you're a little nervous. A lot of people sometimes are very nervous about talking to their clinicians about their use. We have resources on the website as well that you can share with them. So that's who we are, leaf411.org. Our toll-free number is 844-LEAF-411. That's LEAF 411. Or it's 844-532-3411. You can get all that on our website with our hours of operation. And we're here to support you. And that's Leaf 411.
This is incredible information. I don't know about you all, but I could see most of us were taking down notes. I think there were a couple people taking pictures of the slides. I mean, this is powerful information, and information is power, right? Knowledge.
Right.
And I love how many resources you all have. This is so wonderful. So thank you. Let me share a little bit about some of the questions that came in. And they were really good questions, I think. One is, do you recommend cannabis for anyone that's in remission? Because I think there's still always anxiety post, when you're off treatment. Is this something you would recommend for someone who's in remission?
I think at any point in a journey, a health journey, it's what's the intention? What are you trying to achieve? So, if you're looking at, my goal is to prevent recurrence of cancer, there's a pretty long list of things I'd start with. I don't think cannabis would be at the top of that list. How you treat your body, how you deal with trauma, your world, your community, your environment, those would all be far and away first and foremost. There's certainly no definitive data that cannabis is effective as a preventative cancer therapy. So if that's the only reason, I would say, again, I'd probably put my focus elsewhere. But after remission, there's certainly still a whole lot of trauma, there's sleep issues, there may be residual symptoms from treatment, neuropathy, for example. So even in a remission state, cannabis could be an absolutely valuable therapy, but I think it's what's the intention. if someone says, hey, I've read all this science, I'm blown away by how much anti-cancer data there is on cannabis, I want to take a cannabis product maintenance, hoping it's going to prevent, I certainly wouldn't recommend against it, because I don't have any problem with long-term or indefinite cannabis use in a safe fashion. So, but I certainly wouldn't say that there's enough research to clearly support that as a preventative therapy.
That's really helpful. Thank you. And, you know, you mentioned the Israeli data, right?
Mm-hmm.
And how important that is. And I totally understand the concept that there's so many different products and they're not comparing clinical trial, you know, cannabis to Ambien, I think was your example. But are there any clinical trials going on in the US right now?
There are some. Clinical trials are extraordinarily challenging. In the United States, THC specifically, or cannabis, the plant, there's some nuance there, is listed as a Schedule 1 substance, which means the highest risk for abuse and absolutely no medical value. That's what a Schedule 1 substance is. Of course, there are other Schedule 1 substances also that have extreme significant medical value in studies that are still on that list. LSD, ecstasy, those are some of the other ones on that list, which have overwhelming good clinical data these days, probably even more than cannabis in certain areas. So that list doesn't have much value for someone who actually looks at the science, but it's a political list. So anyways, it makes it extremely hard to study. You need special license to study. So there's very few human trials in cannabis, and there's no trials using the products that are available on the market. So if you do a study, it has to be with very specific cannabis obtained. It's from the University of Mississippi, where they have cannabis grows. And again, it's just not products that are similar to what people have options to. So the human studies tend to be more in other countries. What we have in the United States, plenty of preclinical stuff, and still plenty of surveys the patient experience, clinician experience, but the products you will go buy at a dispensary, those essentially cannot be studied in the United States. So we rely a lot on other countries, Israel, Spain, Italy, South America even, have growing numbers of human trials. And the US is just way behind. We're way ahead on legalization and way behind on education and research, which, whatever, take that for what it's worth.
Interesting. It's really interesting. And so we had a couple of questions around, is it required to get a prescription from your physician?
So every state is completely different, just to add a level of complexity. So I certainly can't answer that definitively on all 50 states. But as we alluded to, even though they're both cannabis, things that have low amounts of THC, less than 0.3%, are called hemp. And I'm oversimplifying, but for all intents and purposes, there's no regulation in that hemp industry. So once you grow cannabis that's less than 0.3%, you essentially can sell it anywhere, mail it anywhere, it's legal everywhere. That's not 100% accurate, but for all intents and purposes it is. But that's tough because, again, there's zero regulation. There's great companies, there's great products. I use them all the time with folks, but probably, I'm just making up a number, but if I had to guess, 80 to 90% of what's available out there is garbage. Doesn't even say what's in the bottle. There's been multiple people who have pulled 100 hemp bottles off the shelves in local stores, and less than half had what they said was in there. So if you're in that low THC hemp cannabis space, you really need to know the company and what to look for in the company. You use a resource like Leaf 411 or others, so you know. If it's above 0.3%, now you're essentially, quote, calling it marijuana. So there has to be some formal legalization, either a medical program or an adult use program. If you're an adult use state, which there's like 14 of those now, usually you just have to be 21 and you can purchase products. If you're a medical use state, typically you need an authorization from a physician to enter into that program. A physician can't prescribe cannabis because it is illegal to prescribe an illegal substance. So all a physician can do is certify you have whatever condition your state has on its condition list that qualifies you to use cannabis. They give you an authorization to use cannabis, and then you're on your own. And in most states, that physician often knows nothing about cannabis, has no knowledge, can't give you any guidance, can't give you any recommendations. They just say, oh, you have cancer. Yep, you can use cannabis. Here you go. Good luck. And so unfortunately, that's the way it is. And some states require physicians to do training before doing that. Some physicians won't do that. So it's, you kind of have to know your state. But in general, you're either an adult use state where you just have to be 21 to purchase products, or if you're a medical only state, you need to get some physician authorization to enter the medical cannabis program. And again, very different in Colorado. You can get an appointment today and pay $60 and get your, you have your quote card in 2 or 3 days. Other states, you have to pay $300-400 and it takes 3 months to get an appointment. And it's, so completely different state to state.
Wow, so interesting. And you answered several questions all wrapped into that one answer, because there were a lot of questions around doctors writing prescriptions for ratio and dosing and where to get the products. And it's, boy, am I thankful that Leaf 411 is around.
Thank you.
I mean, this is so powerful and so helpful. All right, so this is really helpful. One other question someone asked was around if you take daily CBD, does your body get used to it, almost get immune, and do you find that you now need to take a higher dose after taking it for a while?
Not as much in my experience with CBD. CBD is what we call a very promiscuous molecule, meaning it binds to all kinds of different receptors. So as I mentioned, it makes our own system work better. It kind of raises levels of our own cannabinoids. It doesn't actually bind to what we call our cannabinoid receptors. It binds to other receptors in the body. So there can be some tolerance for certain effects, especially where CBD directly binds to a receptor. But I would say in general, CBD tends to be more successful long-term as a maintenance therapy. THC, when used at higher dosages, there's definitely going to be tolerance buildup. I would say for folks who are only using it for kind of a very focused medical reason, where lower dosages tend to be used, that doesn't happen that often. If someone's also using, it more regularly, it's just part of their life, or they just need higher dosages for medical use, some tolerance will develop, though that tolerance resets pretty darn quickly. So we often, for daily users, just introduce some holidays of where they don't use THC for 2 or 3 days, and really tolerance resets pretty quickly there. So it's not hard to reset that. And we just work that into their regimen, like pick a weekend where it's not going to be as busy, or you can use something else for pain, or get your acupuncture or your massage set up, or, you're going to be in you don't have anything going on and you can just relax. And so take 2 or 3 day holiday of THC and typically you'll reset tolerance pretty quickly.
Okay, that's really helpful. Thanks. Someone asked what your thoughts on THC, like what your thoughts are around using THC with hormone cancers.
So I still think it's fine. There's some data suggesting possibly very, very high dosages of THC could be a negative in hormone sensitive cancers. There's no absolute dose where it said. So again, a lot of this is in labs and in animals where if exposed to extremely high amounts, there's some question that could be problematic for hormone sensitive cancers. But the flip side of that is there's also a lot of personal stories of people using very high dosages of THC to treat such cancers that have been deemed, unmanageable by other therapies. So I think there's caution involved, but certainly cannabis for symptom management in a hormone sensitive cancer, I don't have any concerns about in hormone sensitive cancers. Other types of receptor positivity, there's increasing data, and this is for breast cancer and HER2 new positive cancers. There's some really interesting data that the HER2 new receptors will merge and essentially form a joint receptor with cannabinoid receptors, and when cannabinoids are bound to those, that blocks that joining and has beneficial effects. So there's nothing I've come across where I would say you can't use cannabis. Again, certain dosages and other things, I might be a little more cautious in hormone receptors, and looked at that data a couple times, but it's out there. Again, the biggest issue where I often might say avoid is again with some of these newer immunotherapies, and that is just unclear. So it's really a decision. What I often tell patients is if your doctor says it's fine to take ibuprofen and prednisone for various things, then I would say I'm not worried about cancer or not worried about cannabis interfering. But again, that's just definitely a one-on-one, not a global decision, because it depends what the big picture is. If someone's having huge symptom problems or side effects from other meds, that may be more of a negative than any negative impact between the immunotherapy and cannabis.
Okay, this is really helpful. We had two more questions. One was, you've mentioned diet and nutrition many times. Is there a great resource like Leaf 1-1 for diet and nutrition and integrative therapies?
I don't think there's a Leaf 411 for diet and nutrition. So I think there's also no one best diet. So just like there's no one best cannabis therapy, I think there's general themes. I mentioned sugar is, one, sugar feeds cancer, but just a healthy diet is the start. But there's no single resource. I think you have to go out there and do research. Really, there's integrative oncologists that are either medical or osteopathic doctors or naturopathic doctors. That's all they do is integrative oncology. So they don't direct your chemo or your primary therapy, but they direct everything else. Maybe what supplements might be helpful, or what diets might be helpful, or other lifestyle things that can be due. There's certainly a virtual integrative naturopathic oncologist that I refer a lot to for those things. My specialty is in nutrition and lifestyle management, so I give a lot of that guidance. You can't kind of make it out of a visit with me without some of that information, but I think you just have to find trusted partners. Sadly, that doesn't often come from the primary oncology and medical team. That's just an unfortunate reality. But some are very much on the ball. I've definitely seen oncology departments or clinics that really incorporate all these tools and really give their patients a huge bevy of resources. Others pretend it doesn't exist. So you just have to know what's my team, what knowledge do I have, and start doing some resource, but certainly no point spot, unfortunately, like Leaf 411 that I can say.
I thank you for that. I don't think there's probably any match for Leaf 411, but it was worth asking.
No.
Quick question: can cannabis help with vestibular symptoms such as dizziness and balance?
So cannabis has a side effect. Too much THC especially can sometimes cause some dizziness, not in the vestibular type of dizziness, usually more lightheadedness and kind of wooziness, but that can sometimes overlap. There are definitely folks that if their vestibular symptoms are kind of really heavily kind of neurologic based, so inflammation of the eighth cranial nerve or kind of some neuroinflammatory process, I'd say there's potential there. Definitely cannabis is an anti-nausea agent through its effects on various receptors in the brain. And so the nausea that definitely can come with vertigo or vestibular symptoms can be definitely improved with cannabis. And so the short answer is that I don't, off the top of my head, I can't think of a study where that's been specifically looked at. So I can't say, oh yeah, I recall this study where it was definitely shown to be beneficial. But physiologically, meaning how cannabis works, there are aspects of that where it could play a role. so reasonable to try. But I can't pull out a study that I recall that being the primary focus.
No, this is unbelievably helpful, and I really thank you both. I'm blown away by the information, and I'm seeing a lot of thank yous and great and helpful and much appreciation in the chat. I don't know if you can peek at those, but people are really blown away. So thank you so much. Just a few announcements. I have just put Leaf 411 and Dr. Gordon's information for 4pillarsdenver.com in the chat, so you have those quickly at your access. I'm going to give you a couple of quick announcements. Let's see if it all pops through. So I'm just going to ask you to save the date. OCRA's Uniting for Hope conference will be September 28th through October 1st. And OCRA is also hosting our Staying Connected support groups. We have 3 each week and then 2 that are monthly. WOCA, Wisconsin Ovarian Cancer Alliance, Yale and Mount Sinai are hosting a panel discussion for those who are newly diagnosed on May 25th at 6:30 p.m. Eastern Time. And then Johns Hopkins, Kelly Gynecologic Oncology Service has a webinar series that has been really fun and people have really enjoyed it. So I just thought I'd throw those up there as some other resources and activities if you're interested in joining, and we thank you. I really want to thank our speakers, Katherine Golden and Dr. Dave Gordon. This has been unbelievably powerful and the information has been so helpful. So thank you very, very much.
Thank you.
And we appreciate you and all that you're doing to make a difference in people's lives.
Thank you guys for having us. We really appreciate it.
Yes, thank you.
So thank you, everyone. Have a good day.
Bye, all.